Okay, Council Chair, we are now live.
Great, thank you. Great. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We're using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligencer prior to the hearings, and can also be found on phlcouncil.com. I now note that the hour has come. Mr. Weiss, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called. Also, please say a few brief words when responding so that your image will be displayed on screen when you speak.
Councilmember Brooks.
Good morning, everyone.
Councilmember Bass.
Good morning. Looking forward to today's hearing. Thank you, Madam Chair.
Councilmember Quinones Sanchez.
Good morning, good morning.
Councilmember Gilmore Richardson.
Good morning, Madam Chair. Good morning, colleagues.
Councilmember Dom.
Good morning, everyone.
Councilmember Squilla. Councilmember Jones.
Thank you. A quorum of the committee is present and this hearing is now called to order. This is the public hearing of the Committee on Housing, Neighborhood Development, and the Homeless regarding resolution number 200408. Good morning, everyone. Thank you to the members of this committee, to Liz Hirsch and her team at the Office of Homeless Services, and to everyone watching at home for joining us for this important conversation. Homelessness, housing insecurity, and affordable housing are some of the most pressing issues facing our city today. We were already facing a housing crisis even before the pandemic. Prior to COVID-19, 55% of renters in West and Southwest Philly were cost burdened, which means they spend more than 30% of their income on housing costs each month. But it's not just my district. Renters across the city are facing this stress on their finances and their day-to-day life. To give you a sense of the scale of this problem, it would cost $74 million each month to eliminate the cost burden for all renters across the city. And clearly, these statistics suggest that there are just not enough affordable housing units in our city. To use the 3rd District as an example, the supply of affordable housing only meets 25% of the affordable housing demand. But now, as a result of the severe impact the pandemic has had on our economy, even more Philadelphia residents are at risk of losing their homes. Sectors that tend to have low wages like leisure and hospitality have been the hardest hit by job losses. This means that Philadelphians who already have to hustle to make ends meet are at increased risk of losing their homes. Without additional interventions like extending eligibility for the PHFA rental assistance program and extending the protections in the Emergency Housing Protection Act, which Council enacted this past June with the support of this committee, more people will need help and will end up on a friend or family member's couch or at OHS's front door. That is one of the reasons why today we'll be focusing on homelessness, which has been a serious challenge in Philadelphia for many years. Both the city government and the city council have worked diligently in recent years to prevent homelessness, to serve the homeless population, and to offer people experiencing homelessness a path towards long-term housing. As I mentioned earlier, we are joined today by Liz Hirsch, the director of the city's Office of Homeless Services. We look forward to her insights about the impact that COVID-19 has had on the state of homelessness in Philadelphia, including how state and federal COVID relief funds are being used, and to get a more in-depth understanding of OHS's operations and outcomes. And I'm glad to share that today's hearing is the first in a series that this committee will host on the topics of homelessness and affordable housing over the coming months. We'll be hearing from a variety of city departments and stakeholders about the state of housing in Philadelphia and what opportunities and challenges may arise from the current precarious situation we find ourselves in. Because ultimately, as COVID-19 has very clearly demonstrated, housing is healthcare. A stable home is at the foundation of a stable life. And so it's critical that housing policy is front and center as our city recovers from this crisis. Thank you so much. This is the public hearing of, oh, wait a minute. Sorry, lost my place a little bit. Mr. Weiss, will you please read the titles of the bills?
Resolution number 200408, a resolution authorizing the Philadelphia City Council Committee on Housing, Neighborhood Development, and the Homeless to hold public hearings on the impact of COVID-19 on homelessness, evictions, and residential foreclosures, and the city's efforts to combat homelessness, evictions, and residential foreclosures.
Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments that they have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. Mr. Weiss, will you please call the first panel or witness we have to testify this morning?
Liz Hirsch.
Good morning. My name is Liz Hirsch. I'm the director of the city's Office of Homeless Services. I am joined here today by David Holloman, Chief of Staff for the Office of Homeless Services, and Beth Gonzalez, Deputy Director for Planning, Performance, and Policy. I submitted testimony to council, and I will run through that briefly and then be available to answer whatever questions you may have. First of all, thank you so much, Councilmember Gautier, for this hearing, and thank you to the committee for your interest in homelessness. It is an ongoing crisis that has been exacerbated by COVID. COVID, I think, has really laid bare the stark realities of the extreme poverty experienced by so many Philadelphians, especially people of color, who have been disproportionately hurt by the pandemic. In Philadelphia, while African-American people comprise 44% of the city's population, they comprise 75% of those who experience homelessness. And as Jamie said, never has it been clearer that housing is healthcare. When the stay-at-home order was issued, the general public saw what we all knew to be true. Thousands of Philadelphia, in fact, millions of Americans, have no permanent home. They lack the most basic human protection. Our city's homeless services system has responded to this crisis. And before talking briefly about some of the steps we have taken and their effectiveness, I would like to recognize the extreme dedication and selflessness of the hundreds of homeless service staff who work for the city and for the not-for-profits who have come to work day in and day out throughout the pandemic to take care of people who had nowhere to go. Their care saved many lives. As of mid-September, our network of nonprofit providers had served over 7,300 participants in our shelter system, with a total of only 161 known COVID cases, about a third of whom were staff. Let me repeat that, 7,300 participants, 161 cases. We have largely succeeded in keeping people safe to date. contrary to myths and stereotypes. We de-densified beds. We went to grab-and-go meals. We instituted social distancing. We require use of masks indoors. We've provided more hand washing and encouraged it, added bed barriers. We basically did all the same things that all of us are doing in our own homes, but in our sites, in spite of the extreme supply shortages that, as you recall, we had in the first few months. Our intake sites have remained open throughout. We instituted COVID screenings at intake to reduce the likelihood that people who were positive would enter shelter. We moved to remote assessment interviews rather than in person to protect participants and staff. One of the silver linings of COVID has been the close working partnership between the Philadelphia Department of Public Health and Homeless Services. Through the Emergency Operations Center, which was activated in March, we've worked hand in hand throughout the pandemic on screening, response, testing, managing, and guidance for services for people who are homeless. The city, in addition to instituting these steps, established a quarantine and isolation site at a downtown hotel. The purpose of this site is to provide quarantine space for people who don't have any place else to safely await test results, who are symptomatic but whose symptoms don't rise to the level of hospitalization, or who have tested positive and need to wait out the 14 days. We're going to continue the Q&I site until the pandemic is over. We need to have that essential service. It's one of the ways that we keep people safe. We also established 2 COVID prevention spaces at downtown hotels with a total of 260 rooms. This has allowed us to move people who are most vulnerable to COVID to live in their own rooms where they can stay safe. Eligibility for these 2 sites is based on the CDC criteria for most at risk, those over the age of 65 or with certain underlying health conditions. It is funded by federal FEMA dollars and CARES money, not by the city. To date, we have served nearly 200 people, half of whom have come from the street. And of those, 70% are 60 or older. So this is a very old and very disabled population of people. This has also been one of the silver linings, is to see them come inside and to be able to have a warm, soft bed, a hot shower, and their own remote control to the TV. And it's just really been one of the gifts that's come out of this very difficult situation. One of the other things that happened with COVID was that it has really exacerbated hunger among those who are homeless. When the stay-at-home order went into effect in March, one of the immediate and dramatic impacts was that the people who were unsheltered were very hungry. We started to get literally dozens of calls from security guards, police, Center City District, saying that people were saying that they were hungry. We had to close our daytime sites in the short term. They've now reopened because of social distancing. And Broad Street Ministry, one of our stalwart providers, launched a program called Step Up to the Plate, which is a partnership with Project Home and Prevention Point. And they raised $2.5 million in philanthropic money, hired out-of-work caterers to make food that volunteers then distribute daily through grab-and-go bags in Center City, South Philly, Kensington, Germantown, and near North Philly. As of last week, 320,000 meals had been served to hungry people. We're now trying to figure out what the plan looks like for winter when we can no longer serve outdoor meals. In addition, during this time, the shelter system served over 1 million meals to the people we house. Today, we're very closely monitoring the economic impact of COVID on those with extremely low incomes, those who have lost income, and those who are homeless or extremely housing insecure. And we have been able to expand our prevention services with funding that came from CARES that's called HAP, or Homeless Assistance Program, the Homeless Assistance Program. We've also gotten some prevention funds from the city's Housing Trust Fund, Home for Good, which comes from the Federal Home Loan Bank, and PHFA. In addition, I know that you are all very interested in the CARES, ESG, or Emergency Solutions Grant money. So let me talk about that for a minute. ESG, or Emergency Solutions Grant money, is restricted funding in its use. It can only be used for homelessness prevention, rapid rehousing, outreach, and shelter. This money sunsets on September 30th, 2022. It's not fungible with city general funds, generally speaking. It's restricted to people whose income is 30% of area median income, and generally speaking, meet the definition of virtually homeless. About half of this funding, about a little over $17 million, is going directly to backfill programs that would have been cut due to the loss of city general funds. Without this backfill, we would have had to lay off about 17 people and take offline about 2,500 shelter beds, among other impacts. This means that OHS will be facing a funding cliff in FY22, representing the potential loss of over $17 million, and similarly dire impacts in the loss of essential crisis services if that funding is not replaced next year. Of the remaining CARES funds, we are implementing a housing surge. Housing cures homelessness. Together with existing long-term programs, we project creating at least 900 housing opportunities. These are estimates. They're subject to change based on real cost and availability. We are going to pilot a tiny house village of 10 to 12 units. This will be one of 2 tiny house pilots. This one is not the Liberation Homes model that you may have read about. This is a Seattle model, or what we call the Seattle model. Each unit is actually 10 by 12. It's basically a bedroom that has electricity and heat. And then there's communal bathroom, suite, and kitchen. And we do have city land available for that. We also launched a shared housing program. What we did was to take vacant PHA scattered site units that have subsidy attached to them. We renovated them to meet housing quality standards. We cannot pay rent to anybody for anything if they don't meet housing quality standards. And these units will house families and some and unrelated adults. And city zoning, as you know, allows 3 unrelated adults. This is an attempt to do 2 things. Well, actually 3. First, it's reactivating vacant scattered site units, so that's better for the neighborhoods. It is providing an option for people who would rather not live alone, and it's an attempt to provide a much less costly alternative for long-term housing, because as you know, rental assistance has a price tag. We are also expanding our shallow rent program. Again, this is a little different than the planning and development shallow rent. This is a pilot that we started nearly 3 years ago. It's designed to house at a less costly way people who have permanent disabilities. So they live on a fixed low income, extremely low income. If we were really serious about ending homelessness as a nation, the first thing we could do would be to increase disability income from the $700 or $800 that it is a month now, and double or triple that so it was actually a living amount of money. Many of the people who experience unsheltered homelessness are in fact disabled and have a very small, modest income. And so the shallow rent program enables them to live stably for paying less than a third of their income every month for rent, and it does have wraparound services. Rapid rehousing, we've talked about a lot. This is a program that's very much promoted through HUD. It is a 12 to 24 month subsidy with housing case management. It is a light touch program. It's monthly meetings with a housing case manager. In the Latinx Hispanic community, we do make this suite of services available without becoming homeless. That was one of the real concerns of that community. So we've responded by piloting a different model. And we have now just launched a rapid rehousing from the street program. This is brand new. This is one of the things that came out of the encampment negotiations over the last several months. And so far we have 32 people enrolled. 4 people have already signed leases, and 4 are awaiting lease signings, and 3 have awaited inspections. So these are very encouraging early results. One of the aspects of our program that sometimes people find challenging is that there aren't as many different kinds of front doors as they would like. And so this is really an attempt to respond to the interests of some people to find easier access into an actual unit. So we'll see how it works. And then we are piloting single room occupancies. We, as you all know, have a lot of buildings in this city, old convents and group homes, et cetera, that they're zoned for multiple people to live. They're shared bathrooms, kitchens, but everybody has their own room. So again, this takes advantage of existing buildings that are vacant. It gives people on-site services. They have their own room, so they have privacy, but they're not all alone. And so we are also putting that on the street. I will say that prioritization for all housing opportunities through homeless services are based on vulnerability. We do an assessment with everybody. This is a HUD requirement. It's also a way of ensuring fairness for everybody. Used to be that the person who yelled the loudest or had the most aggressive advocate got access to housing, and we have tried to make this a system that is fairer. The top priority today is for people over the age of 65 or with chronic underlying health conditions who are most vulnerable to COVID, followed by those who have significant disabilities and long-term homelessness. And this applies both to families and individuals. So with that, I just want to also mention that the ESG programs that I mentioned above there are requests for proposals on our website. We are encouraging new providers. We've gotten new proposals from some providers we've never worked with before. And as part of the continuing commitment of the city to increase diversity, inclusion, and equity in our investment of public dollars, we're trying to make these as accessible as possible. So if an organization has a little piece of property, they'd like to try something, we encourage them to send us a proposal, and we will work with them. We will to try and be able to use the funds that we have available to house people. So with that, I'll conclude my testimony and return the floor to you, Council Member.
Thank you for your testimony, Liz, and for all of the work that you and your staff have done to respond to COVID-19. I'm going to start off with some questions, and then I will turn to questions from my colleagues. Before I get into my questions, I wanted to raise a point from last week's hearing before the Committee on Fiscal Stability and Intergovernmental Cooperation. During the hearing, Harvey Rice, the executive director of the Pennsylvania Intergovernmental Cooperation Authority, said many city departments did not meet their performance goals for FY20. According to PICA's final city manager's report for 2020, the Office of Homeless Services met all of its performance goals for FY 2020. So kudos to you and your team, and thank you for working with my office prior to this hearing as well.
Thank you.
Based on the number of people that OHS has provided traditional services to thus far in calendar year 2020, are you seeing an increase in the number of people accessing OHS services, or is OHS on target to serve a similar number of people that you served last year?
The number of that's the $1 million question that everybody's asking right now. What's the economic impact of COVID? I would say that our prevention services are seeing an uptick, and people are calling about rental assistance. Our shelter services are about level.
Okay, thank you.
And family services, family homelessness is actually down, and demand for shelter among families is down. We don't know why. We think it's possible that families are just holding tight, but we don't really know. But that's been a trend really since March.
Thank you. During your testimony, you talked about the restrictions on some of the federal money. If these funds were unrestricted, would you spend some of the dollars differently?
You betcha. I think what we really need, there's really two things that make the biggest difference in our estimation in really preventing and ending homelessness. One is I would invest more in prevention. I think there are more individuals. When you look at the number that over 10,000 people entered shelter, I've got to believe that more of those people could be stabilized with an investment of prevention, that they have resources, they just can't make ends meet. So I would put more into prevention. And we're not just talking about evictions, because many of the people only 20% of the people who come to our door are the actual leaseholder. Either they're too young, or they've been homeless too long, or something in between. They just are, they're really people who have much lower incomes, and they need a longer runway to take off. So I would put more into prevention. And then the other thing I would do, and this could be done through us or through planning and development, is really have a full-fledged city rental assistance program. As I said, with the average income of the people in our system is about $10,000 a year. And if you're a senior and you're living on Social Security alone, it's about $11,000. And if you have a disability, it's less than $10,000. That's just never going to be enough to pay a market rent. And so in our view, there's only two ways to cut it, right? You either increase incomes so people can afford a market rent, or you subsidize the rent in some way, shape, or form so that people can stay stable. And so if I had the wherewithal, I believe we need a city rental assistance program, a long-term program for those people who will never be able to pay a market rent.
Great, thank you. I also want to take a moment to recognize that Councilmember Squilla is in attendance, as well as Councilmember Kim. Good morning. Okay, let's stay on prevention.
Councilmember Jones as well.
Councilmember Jones, good morning. My vice chair, thank you.
Yes. All right.
Let's stay on prevention for a little bit. Over 1,400 households in FY20 received prevention and diversion assistance. We understand that OHS was only able to meet about 25% of the demand for rent assistance in FY20 due to lack of funding. Can you give a brief description of prevention and diversion services, elaborate on the effectiveness of prevention and diversion in terms of preventing homelessness, and estimate how much OHS saves for every dollar of investment into prevention and diversion?
Yep. So actually we served closer to 1,900 people, but about 450 people didn't require financial assistance. It was mediation. You know, my sister kicked me out, or my mother's going to kick me out, or something like that, and trying to help them figure out how to navigate stabilizing their housing situation. In a 2-year look back, no one who has received our services has entered shelter, which just gives you, I think, a window into just how resilient people are, that a very small amount of money helps them stabilize, and how motivated people can be to avoid becoming homeless. It always just amazes me how scrappy people really are, and that as few people become homeless in a city like ours as they do. So the main thing that we do, in addition to the mediation and conflict resolution and problem solving that our team does, is actual rental assistance. In the past, we focused mostly on one-time rental assistance with a small portion on multi-month, but with the eviction crisis and the really much more robust suite of services that the city is now providing around eviction, we have a new kind of division of labor where planning and development is doing much more of the eviction prevention. The Philadelphia Eviction Prevention Pilot is operating. All of the rental assistance is really working with them, because we believe it really needs to be nested ultimately in the housing counseling agencies. And then the homelessness prevention, which is, again, people who have much smaller incomes, who may not be the leaseholders, we are working much more with them. And we are moving much more towards multi-month assistance so that they really can stabilize, get a better income, and get their housing situation to be less secure.
And in your
more secure, less insecure. Sorry about that.
Got it. In your estimation, how much are we saving for every dollar of investment that we're putting into prevention and diversion?
So there's not a lot of data about what prevention actually saves, because the question is, if you're successful, you can't measure it, right? Because people never enter shelter. So then the question is, would they have entered shelter anyway? Or are you basically over-serving people, which, is fine with me, but that's not the purpose. So the best data that exists nationally suggests that about 20% of those who serve through prevention would have become homeless. And so we estimate that we save about $4 for every dollar that we spend.
Thank you. I would like to ask you about the emergency and temporary housing that you provide, because about 56% of OHS's overall expenditures fall into this category of services.
Yes.
But can you give a brief description of the types of emergency and temporary housing options that OHS provides for the record?
Yes, of course. We operate between 43 and 46 emergency sites. It used to be that those sites or shelters were very large. We've really tried to move to much smaller sites. They work better. They're better for people. We get better outcomes, and it really spreads them around. Our family sites all have individual rooms. Our singles sites are largely congregate. They're all over the city. We have, when we did our housing inventory count last January, we had about 3,800 beds. We have somewhat fewer than that at this time, although we do have beds available. These are, generally speaking, very low demand. We do not do drug testing for entry, although you may not bring in weapons or works. We do have curfews in all of our sites, mostly because people are sleeping and because they're in neighborhoods, and it's just darn rude to be coming in and out at all hours. So we do that. And we do provide case management, one case manager for every 20 people. Everyone does have a housing plan. They do work with their case manager on a housing plan. In addition, we have no time limits, although our average stay in shelter is 86 days. So we turn over our beds on average 4 times a year. There are some exceptions to that. By and large, our longest stayers are Megan's Law offenders because they have the hardest time finding employment and permanent housing. Although we do see a cycling through of that population that I was talking about who has very low fixed incomes, who's disabled. We have about 1,000 units of transitional housing. That's a net reduction over the last several years. That has to do with HUD policy. A transitional housing is no longer recognized as an evidence-based practice or a data-informed practice because the results that you get in terms of long-term housing and stability and preventing a return to homelessness are about the same as rapid rehousing, which is about half the price.
Okay, thank you. Your FY20 numbers show close to 15,000 people using less than 4,500 beds of emergency housing. Can you discuss the utilization rate of emergency shelter beds and how lengths of stay can vary among shelter options?
Yeah, I think I did sort of just touch on that. Is there something more that you wanted to know about it?
Did you discuss the utilization rate?
Yeah, mostly we run at about a 90% utilization in our single shelters. We are seeing family homelessness go down. It's dropped by 25% since 2017. So we are looking to take 2 family shelters offline and convert them into rapid rehousing rather than shelter this year. So we are evaluating at this point in time Philadelphia doesn't have families on the street. As soon as there's a family, we swoop in and get them housed, and we house families together. And if it's 2 parents of the same gender, if it's a father only, it doesn't matter. We house them together. We are an equal access system. And so we are looking at our family shelter supply, but at this point in time, until we see the economic impact of COVID, we're very reluctant to take dramatic action in reducing the supply of crisis beds that are available.
Thank you. I have a few questions about outcomes in this area. Roughly 30% of consumers who utilize emergency or temporary housing in FY20 exited to permanent affordable housing. First, can you give us context for this data? And then can you talk about whether there are difficulties tracking all of the exits from emergency housing, and what are other possible outcomes for consumers?
Well, I think the context is exactly the information that you provided in your introduction, Council Member. It's the shortage of affordable housing. That if everybody had a place to live in the first place that they could afford and an adequate income, they likely wouldn't become homeless, or we would certainly be seeing much smaller numbers. We don't control the supply of affordable housing, and so our ability to help people exit has to do with either the resources we're able to get from the city or HUD, or the resources that are available through the affordable housing system, or to whatever extent people are able to increase their incomes. So we're working in the same environment as everybody else. We've been working in terms of your second question around data, completeness, and quality. This has been something that's been very important to us. It is one of our performance measures, is data quality and completeness, and our numbers have gotten to be very good. We're at about 90%. But we still, I would say we still have some, we always have a way to go it's hard to sit down at your computer and write down, when you're trying to help somebody.
Great, thank you for that context. I'd like to dig a little more deeply here. Can you explain OHS's specific role in helping consumers to obtain permanent housing, and let us know if there are any barriers to affordable housing that consumers leaving the shelter system encounter, aside from a general shortage of supply in the low incomes of consumers?
Yep. So our housing case managers work with everybody on a housing plan. As I said earlier, we do an assessment of everybody. And those who are most vulnerable, we match with whatever available housing we have. In this administration, we have invested for the first time in the city's history, city general funds on permanent supportive housing to try and reduce the numbers of people on the street, which we have done. The numbers have gone down. I think one of the real obstacles is really the nature of affordable housing. Over the last about 20 years or so, the supply of affordable housing and the production has really dwindled, as you know. And by and large, what's available is affordable only to people who are at higher incomes. So in order to get into a low-income housing tax credit development, you have to have a decent credit history. You don't know criminal background. People who have a lot of problems coming out of our system, it's a leap of faith. They can be very good tenants, but they do require services. And the way the cash flow for tax credit developments work makes it very, very hard. So I think that's really one big obstacle, is just the nature of the affordable housing system. And frankly, the other big issues are the feeder systems. The criminal justice system is probably one of our big feeder systems. It's not at all unusual for people to exit the criminal justice system and come right to shelter. I think that's probably one of the big issues. Hospitals and healthcare systems also are one of our big feeders. And so I think the homeless system is really absorbing a lot of the shortfalls of other systems, or some of the things that we know to be systemic drivers of poverty and homelessness. And we're trying to address them, with inadequate supply of affordable housing.
And then I have one more question before I open up to members of the committee. Are there ways that you think the public sector could be better in reaching out to the private landlord community to either incentivize them or push them to take on Philadelphians coming out of supportive or emergency housing as tenants?
Yes, absolutely. I'm glad you asked. We'll be putting together a packet of information in the next couple of weeks, asking just that for private landlords to help us. We do get a lot of calls from them. Often they need money. They're trying to make ends meet. They're working in the same economy as we are. But yes, that would be very, very helpful. And I also think that if you could help us in really looking at the criminal justice system and how and when people exit and where they exit to, and finding other ways to help people successfully transition. Returning citizens, we know that when people have housing, they are much less likely to recidivate. And in also bringing the health insurance companies to the table. We save them money. When people are housed, they cost less to care for in the health systems. And so bringing those managed care organizations to the table would be extremely helpful. So those are some direct intervention places that I think would be helpful. If you don't mind, Council Member, if I'm going to ask Dave Holloman if there's anything that he might want to add to what I've said that maybe we've glossed over or needs to be elaborated on.
Sure. Good morning, Dave.
Hi, good morning, everyone. I think, Liz, you covered a lot of information. I think I appreciate the questions that you asked, Councilwoman. And I think one of the things that we deal with as a crisis response system is that we deal with some serious complexity, not only with behavioral health challenges, but traumatic issues, loss of income, fire disasters. So when individuals that do come to our front door, we're dealing with the extreme poor population that really comes to our front door. I think one of the things you talked about earlier, and one of your questions was about funding around prevention. We really would have to do some type of study or dictate some type of study of what that would look like in terms of how long do you extend that funding, whether it's 3 to 6 months, whether it's a year, to a person increase their incomes. Philadelphia is still dealing with income inequality, large poverty rate. So you would have to calculate all of those things to really try to get a more accurate reflection on how much funding that you would dedicate to prevention care. But I think, Liz, you did a really good job of really displaying and covering the majority of the things that we need. Of course, if there were, lease restrictions on the dollars, we can be more flexible around there. Philadelphia is in a unique place where there's still pockets of some what we consider to be affordable housing compared to our neighboring like DC and New York. But it would help if we had a communication strategy also to really recruit these landlords to help be better landlords that would take on people who are dealing with these problems some of the problems that we're seeing that are coming to our front door.
Thank you. Councilmember Quinones Sanchez, I know you have a question.
Thank you. I had a couple. Thank you so much for the entire team, and thank you, Madam Chair, for pulling this together. I think it's important that we do kind of a reset around what services we're offering. I think one of the things that has come out of COVID is this need for us to be very intentional and focused around these historical disparities that have existed. But Liz, you mentioned something earlier that caught my attention before I get to a couple of my questions around the transitional housing no longer being considered evidence-based. How much of your portfolio is in transitional housing? When and if are you moving away from that? And what is the cost per person and family in those product lines that are harder to fund? And do you also believe they're no longer evidence-based? Is it that they're unsuccessful, or how would you advocate or articulate that?
Those are really good questions. We have about 1,000 transitional housing beds. That's about half of what we used to have. The way HUD Continuum of Care funding comes, Council Member, is that there's a set amount, and the only way you can expand the supply of units is to reduce non-performing providers. It's very Hunger Games. So that's what we've been doing over the last several years since they implemented this system. We actually do a competitive blind competition, and our lowest performers are defunded over time, and then that money goes into permanent housing. I think that rapid rehousing, it's a decent proxy. It's 12 to 24 months. It's about 10.5 a year. So it's less costly than transitional. Transitional is very good for veterans, young mothers, or young parents with their children, because it's very service rich. It's mostly congregate, although people have their own rooms. So I think that Rapid, it does a lot, does a lot for people. I think it's a decent program. I think that really it's distinguishing between people who, with a little bit of help, could go back into the private market, that they could work, get an adequate income, and then move off of subsidy altogether, versus the people who are older, have been disabled a long time, have low fixed incomes, or very complicated family situations. So I think it's really trying to match the right housing strategy with the individual. And I think that's where the art form comes.
How much of your portfolio is still within this product line?
Transitional, it's 1,000 units. And these are all site-based.
What is the cost?
1,000 beds. It's, I don't know exactly how many buildings. It's all site-based. For example, Druding Center, People's Emergency Center, those are some, I believe there's some veterans housing. Those are the kinds of transitional housing. And they're all, I think, Gleck up in Germantown, I think, has some transitional. They're largely HUD funded.
How would you transition these into, when you look at the cost factor of, $10,000 a year, the average client and families, my understanding, takes a little bit longer, between 12 and 12 months. You're talking about potentially an investment of $20,000 to $30,000 per family. How can we best transition this to the shallow rent, some of the other product lines that you're talking about that you say are more productive and give people more independence, more decency in living, in light of the fact that they're going to be, we can't increase their income, but we can improve their quality of life if they have more stable housing?
Yeah, so I may have misled you a little bit. Some of these are what HUD has determined is that transitional housing is appropriate for certain quote unquote populations. So young parents being one, I think domestic violence is another, veterans who have a history of trauma is another. And so all of those are most of our transitional housing at this point really is, we don't really have a transition plan for it, because the way the HUD rules are, we would have to figure out a way to do place-based subsidy of some sort, and we really can't do that. Like, we wouldn't want to have Druding or Gleck or PEC be empty, right? So what we've tried to do is really tailor it to match the funding and the model with the people who can benefit. All that being said, we're happy to take a look and see if there's any flexibility. I don't know if Eva or Dave or Beth has anything to add on this topic. It's something we spend a lot of time worrying about, frankly.
Yeah, I think the one thing that we're constantly in that area of trying to find out what is the right sizing of our system. I think one of the things that we have, and which is unique in Philadelphia, is that we have just about every model there is to determine what is the right amount has always been a major challenge. And I think one of the things that COVID has allowed us to see is, one, it has peeled back the Band-Aid off a lot of other social factors that goes into some of these housing. As Liz indicated earlier, HUD, a few years back was really, really pushing strongly to reduce transitional housing to turn more these programs into more permanent housing. I think what they're starting to see is that as cost of living starting to increase in many of these different areas, I think they have started to slow down also on that approach. But we would love to partner with you on, trying to figure out what is the right size for some of these models that are currently we have in Philadelphia. But it's $1 million question that we just don't have an exact answer to at the moment.
I know. This is when sometimes, we become embedded with programs and agencies. And look, these agencies do really good work, but in a post-COVID world, things have changed and we want to get people to permanency. And so when you let a system lag for 12, 24, 36 months at a very high cost, we're better off giving people those resources so that they can get to that permanency. And we've been really reluctant to look at this space and how do we get some of these providers to create the permanency we need versus creating these transitional models that are pretty costly. And I just want us to remain open. I talk to a lot of these providers. I know them personally. I've visited their sites, but if we want to change our methodology and say certain people at 15, 30% AMI are going to need permanent support, then we need to provide those models so that we know we're subsidizing them. When you tell people you're spending 10, 15, 20, 30,000 on one family in a market where you can potentially buy them a house, people don't understand that. I just think we need to move to models that really promote some level of independence and some level of permanency. Real quick, because I don't want to monopolize my time, and I appreciate the chairwoman for allowing me to come in since I have to go. One of the challenges for us, as you know, in Kensington has been the reluctancy by the administration to come up with an encampment policy and how to deal with homelessness. I think it's really, really important that in order for us to get people to support additional investments in this, that we let them know what they get for that, right? That nobody wants to see people in the street. So how do what are the lessons learned from the Parkway that have gotten a lot of attention? Kensington, it's been 3.5 years and, not always as much. What have we learned from the advocates that is pivotal and that you think is going to impact how we move forward in dealing with this portfolio and the work we're doing in this space?
Well, I think the Parkway is a very different situation because it's not an organic encampment. It was established by a group of people as a protest. They came in one day, or I remember the day well, and set up a bunch of tents, and then they went and got homeless people and moved them in. So it's a very different situation than Kensington, where the drug trade has really, I think, brought people, unfortunately, people who are homeless and people who are not homeless to the streets of Kensington. The lessons that we've learned about encampments so far are the ones we learned by resolving the 4 encampments in Kensington in 2018 and 2019. And that is providing people with the services they need that are tailored to what they want, absent the ability to force them off the street. We have to entice them. Bringing services to them like mobile drug treatment and making it as easy as possible, and setting a time limit and having that time be, and then sticking with that deadline. I think those are the things that we learned and did in Kensington. I will have to say to you, council member, that we very much agree that we need an encampment policy. And I think it's very tricky, and we are working on it, and we hope to work with you on that. As you know, one of the issues that we've had to deal with is that the courts have been very clear that you can't take tents away and you can't move people unless there are real options for them. And so we're still trying very much to figure out how to do this. And, it's still a very important question.
Yeah, I think one of the things I would just add to that is, Councilwoman, going back to those in Kensington encampment and these encampment, there are some common denominators. The one thing that it has shown us and has been evidence proof is that then if you invest in housing opportunity for individuals, you will see people will decide to go in. I think one of the things that have come about from the large encampment that's been on the Parkway, even though that it started as a political protest around the need for investing in affordable housing, there are similar common denominator that goes towards both camps. And again, people can't afford places. There's a lack of affordable housing in the city of Philadelphia where people just want access to. I think, going back when we had the PHA relationship where we had a number of housing opportunity through them, we saw direct results in vouchers and less numbers of people on the street. So I think, when we pull away both, the city has been struggling with the opioid crisis. I think that's not just in Kensington, that's all over. But what we're seeing is, again, people just don't have the economic needs in terms of income and the need for affordable housing. Those are similarity that goes across both encampment. I do thank you guys for continuing to look at and coming up with opportunities to invest in housing. I think that is the way how we reduce many of these tents in areas that have gotten a lot of attention, but the constant need for investment in housing, in affordable housing, and making it more easier or more acceptable for people to take will have greater impact in the future for Philadelphia.
Yeah, I did want to add to that something that I neglected to say, which is that last summer, thanks to the investment of all of the resources that we had made, we were down to about 200 people who were homeless in Kensington. And it's been a devastating blow. The pandemic has just been a devastating blow for all of us. But I think that the one thing is that for people who have less economic resources, like many of the people, the residents in Kensington, they don't have as much above a buffer, and for neighborhoods that are highly impacted, that the pandemic has hit them much worse. And it's really been, I think it's fair to say it's really been a setback. We were making progress up until the pandemic hit, and it's just been heartbreaking. And we do need a new resolve and a new way of tackling it. There's no question about that.
Thank you, Madam Chair. I look forward to the continuing conversation around this matter. Time sensitivity as we come up with policies is huge. I think that the Parkway, for folks in the Parkway who thought that, that was untenable, Kensington is untenable. These encampments are going to pop up in every part of the city, and I don't want to see my colleagues struggling the way we're struggling here in Kensington and explaining why we can't move with a sense of urgency. But I appreciate everyone's effort. Thank you, Madam Chair.
Thank you, Council Member. Council Member Dom.
Thank you, Madam Chair, and good morning. And good morning to my colleagues and Liz. I have a few questions to follow up on Councilmember Maria Quinones-Sanchez's line of questioning. And by the way, I'm in support of what she had mentioned about Kensington. I've taken several tours through there, and it's really declined during this pandemic. And it's heartbreaking, actually, to see what's going on there. It's horrible. I can't imagine living there. Well, here's my questions for today, Liz. Can you explain your department, the priorities? Are they for the homeless population? Is it a shelter?
Joe, would you mind doing? It would be so fantastic if you could.
Hi.
Thank you so much. No, I think.
Hello.
Yeah.
Hello. If you're not speaking, please go on mute. Thank you.
Thank you, Madam Chair. Can you explain your priorities for our homeless population right now? Is it a shelter first model or wraparound services for everyone?
Our priority is always getting people in from the street. We don't want anybody living on the street. It's a mortal danger to live on the street. So that's always what's most important to us. All of our services are designed to be low barrier. We are a housing first system, which means that our goal and our top priority, council member, is for people to come in. We try to provide a wide variety of front doors, whether it's the COVID prevention space, the hotels, whether it's a safe haven, a drug treatment program, a shelter, or now rapid rehousing from the street. And then we have a very small number of pathways to housing units for people who are most seriously mentally ill and have the most fragile health and have been homeless the longest. So that is our priority. And then our priority is for the most vulnerable people to get into permanent housing. What we try to do, and it's more art than science, is for people who need less. We try to keep as light a touch as possible. So we start with the lightest touch set of services and hope that people succeed before we go to a more intense or expensive or labor intensive set of services.
Okay. And so just in a big picture, I believe the Office of Supportive Housing's budget's about $100 million, roughly.
Yes.
And if you were to fund both the housing, sheltering, and the wraparound services for everyone, we're talking about in the city of Philadelphia that we know of, what do you estimate that cost might be of supporting those people at this time?
$31 million.
31 million on top of the 100?
I haven't done that math lately, but when we brought in a national consultant to estimate the number of permanent supportive housing units that we needed to prevent and end chronic street homelessness, the number was 2,500 units, which based on current rents, we estimate to be at about $31 million.
What do you estimate the current rents to be per bed right now?
The fair market rent for a one bedroom, generally speaking, is between $900 and $1,100, depending on which neighborhood. So
Okay.
we estimate our costs have gone up slightly. It's a tight rental market, surprisingly. So we used to estimate $12,500 a year. Now our latest numbers are closer to $12,900.
Okay. And do you have any kind of sense of what all of the nonprofits or outside agencies that you work with spend on supporting the homeless population in total?
That would be your $100 million plus whatever their independent budgets are.
Do you have any
They have-
idea what those budgets are? No.
No, it's a great question. I don't have that number.
I guess what I'm trying to find out is to get a better understanding of how much the entire city of Philadelphia is, I'm not going to say spending, I'm going to say investing on supporting homeless services. And what's the total pool of money, including the nonprofits, the federal, the state, and city money, and how do we better, utilize that money towards all of our goals? That's really if someone could do that analysis, I think we'd have a better understanding of what is the pool of potential money across all departments that we can utilize to achieve these goals. So my last question is, do you have these organizations and layers of government where you're convening meetings to bring them together, and can council help you convene these meetings, maybe through this committee, to get everyone on the same page with clear and measurable goals that we can move the needle, because now we really need to, and see where all this money is being spent. I'll give you one example. We took a tour of modular housing out in West Philadelphia, and we were told, the cost for modular could be $80,000 to $90,000 per unit. And when you look at that cost finance at today's rates, it could be, low. It could be like $600 a month, where we could actually save some money here and, have a total focus on, for every one bed we're providing today with modular, we might be able to provide 2 beds. So I'm just using that as an example, but there are some probably areas where we could save some money and help you achieve those goals.
Well, if we could figure out better models, we're totally open to that. I think that's a great idea. I think the homeless system ends up, kind of being the course of last resort for people, where a lot of other systems fail, frankly, for people. We have moved the needle, though, council member. The rate of family homelessness, the numbers have dropped by 25%. As I stated earlier, no one who's gotten homelessness prevention assistance has entered shelter. Our number of people who are unsheltered is at a 4-year low after peaking with the opioid crisis a few years ago. So we have moved the needle. Our average length of stay has shrunk in our shelters, so we are moving people out more quickly into permanent housing. We are helping people gain more income through their stays in shelter. So we are moving the needle. It's just not, the scope is not big enough. And I guess the other thing I would encourage everybody to think about is, where does the homeless system begin and end, and where does the affordable housing system begin and end? And where does the workforce development and employment system begin and end? When the city did its talent engine report, it literally did not go as low as people with zero income. There's we created a no barrier employment program through same day pay, but the homeless system can't do it alone. We are the crisis response system. We have to look at all these other systems, like I mentioned, healthcare, corrections, and look at what else we can do in those places so that people don't become homeless in the first place, or if they do, that they really do have an exit strategy of increased income and a more affordable place to live. So to that end, I think the modular housing would be terrific. We think it's a viable option that's definitely worth looking into, and may even be able to be largely self-financed. Same thing with some of the tiny houses. That's why we're doing all these pilot programs.
And I will say this on the modular, if you take it over a 15-year term mortgage, it would be paid off in 15 years. The payments would be about half of what we're spending now, and we would own it in 15 years, free and clear. So that just may be something we should consider, because we could take advantage of those low rates. Let me just mention one other thing.
I do want to say one thing, Council Member, is our shelter beds do turn over 4 times a year.
Okay.
So the number is not the number. When you look at a number of shelter beds, unless we can stop the churn of people coming through, it's not a 1-for-1 replacement. And I think that's what's really held us up from making those dollars fungible from beds to units.
And so, I mean, I view housing as a ladder, okay? We always used to say that the first step on the ladder was the first-time home buyer. But maybe we need to look at it now and say maybe the first step on the ladder is shelter beds. Next step on the ladder might be a nice rental, and then the next step might be going into buying. We should look at that as a committee maybe, and how we advance that ladder to move people up and economically move them up. Because what we're talking about today is really a function of the fact that of the top 20 cities in the country right now, we're at the bottom basically of job creation and entrepreneurial businesses. And so it's the economy to a degree that's causing us to have to deal with this issue. Because if people had better paying jobs and better opportunity and, were able to make more money, we wouldn't be in this situation. Anyway, I don't want to take any more time. I appreciate your time, and thank you, Madam Chair. Thank you very much.
Thank you so much, Council Member. Council Member Bass. Council Member Bass, are you there? Are you on mute?
Good afternoon, or good morning. Good morning. So I do apologize. I was having some difficulty coming off of mute. But I want to first start by thanking Liz and her team for all of the hard work that they do. I know that I've met with Liz out at a shelter in my district, and I'm just thoroughly impressed and amazed with the work that they do, and can't say enough to support the work that you do. And
Thank you.
I just think that you do a phenomenal job with limited resources, and I think that your department deserves much more, because there's no excuse, there's no reason that anyone should be homeless or houseless in the city of Philadelphia. I just don't think there's any excuse for it whatsoever. But I know you do your part, Liz. So again, many thanks and kudos to you and your team, and Eva and the whole crew. I had a couple of questions. I had 2 questions. One was that I noticed earlier in your comments, and I'm wondering if you can go back. You said something to the effect that 2 shelters were underutilized and were likely to close, or something to that effect. Can you revisit that for me?
Yes, we have 2 shelters, 2 family shelters that our goal is to repurpose them. Currently, we are working with them. We're converting their shelter funding to rapid rehousing so that the families that are there can move out. And then one of them, I think, would need to be renovated. We're looking at as single room occupancy or efficiency apartments for youth. And the other, we're looking at repurposing to be for young parenting families. As I think everybody is really well aware, if there's one thing we can do to end the cycle of poverty and homelessness, it's to help children and young adults. And so the more we can take these resources and put them into long-term housing for those really highly vulnerable populations where they're still growing and they're still hopeful, and they're still resilient, that's really where we want to create growth in. And so that's what we're looking at in those two instances.
Can you say which shelters those are? Is it confidential, or can you say what the locations are?
It's not confidential, but at this point in time, I don't know how widely known it is. I know that we've been discussing it with them. Maybe I could follow up with you afterwards. They're not in your district.
Okay. That's why I was wondering.
You're breaking up.
Councilmember, we're having a hard time hearing you.
Is that better?
Yes.
Yes.
Okay. So, just piggybacking off of your statement, Liz, in terms of housing for young folks, young families in particular, one of my great concerns is about the number of young people who age out of the foster care system and who immediately, in many cases, become candidates for homelessness in the city of Philadelphia. And so what is your interaction with DHS to prevent these sorts of occurrences from happening?
Yeah, that's a great question. Well, let me start with a highlight, and I'll defer to Eva if she wants to add something. We expect to launch in a relatively short time an opportunity for 16 young people who are aging out of the foster care system, and who are getting the free tuition at community college. We expect to be able to provide housing for them, again, through this program of renovating 2 buildings that were PHA housing. So we're really excited about that partnership as one of the, again, a pilot program that may help us. We have also just funded DePaul House, and they are providing housing for about 20 young people who would otherwise be homeless, who have come out of the shelter, the foster system by and large, and it's really to support them in college, because we all know that education really matters.
Yeah.
Above and beyond that, we work very closely with DHS to try and do everything we can to help those young people secure housing so that they don't end up in the homeless system. We have a youth access point. We meet regularly with DHS on coordinating with about who's who. We have youth navigators. So we really are trying to work very closely with them. And as with everything else, we still have a long way to go. So let me defer to Eva to see if there's something I missed, because she really works with all of us, both DHS and OHS, on this.
No, I think you covered it. I think there's a daily ongoing interaction between DHS and OHS in terms of particular individual cases. And then I guess I would say, Liz, was it 3 years ago that you first funded kind of the collaborative of youth serving agencies?
Yes.
Which came together as a team. And so some of the work that Liz reflected back was part of that effort about 3 years ago, and 5 agencies who serve youth came together, expressing their ability to play different roles in that system. Mm-hmm. And we are looking forward to the shared housing program that will support some of the other work that CCP is doing to provide very low-cost housing for some young people aging out of foster care going to CCP.
Okay, very good. Do we have an idea of how many young people we serve per year in this role? What the number is?
Let me get back to you on that, council member.
Okay. And also, could you give us a sense of how many go uncaptured?
Yeah.
Will?
Yeah, sure.
Yeah.
Yep.
Okay, so that would be great. The other part to my question was, and I may have missed this. Can you tell me what's the total population of folks who are considered homeless in the city of Philadelphia? Do you have a number or percentage on that?
I do. We use a point in time count, which is it's the HUD measure. It's January, the last Thursday in January we counted. Last count we were just a little over 5,600 people who at that moment in time are homeless. That includes the 950 or so who were unsheltered, that is literally on the streets or in a place unfit for human habitation. And then the remaining 5,000 or so who were in emergency or temporary housing, which in Philadelphia includes safe havens, which are mental health facilities, and recovery houses. They are considered to be part of the homeless system. It's for some folks. Over the course of the year, we served 19,000 people. So 19,000 people experienced homelessness in fiscal year 2020, a little over that. So a lot of people are cycling through our system or touching it for a short time. And that doesn't include the prevention numbers.
Okay. Should we be counting people who are waiting for housing through, let's say, a PHA or, another a similar entity who are maybe either have a voucher or, even though there's no more vouchers right now, but people who are in line and who have been in line, I would say, for years for housing, who are living, cramped up. Let's say they're living with their mom, maybe it's a 3-bedroom house, a standard row, and maybe there are multiple families living in that house. They're not homeless, but they are in an untenable situation as well. So is there any consideration of adding those people to our list who are also awaiting housing and who, but by the grace of God, are not, sleeping in our shelters or unsheltered completely?
Right. Well, this is a big debate that goes on. We generally consider our point in time count to be an undercount. We believe that there are many more people who are flying below the radar screen who really are homeless. They're just sort of nipping and tucking to pull it together and not actually falling into actual homelessness. We have adopted the HUD definition of being literally homeless. And the folks that you described as being couch surfing, living in overcrowded situations, are really, by HUD standards, considered to be extremely housing insecure or imminently homeless. So it's really a definitional issue. We would consider them to really be to require the intervention of the affordable housing system. So either they would need prevention services, or what they really need is affordable housing. And every effort should be made to have them not be homeless. So that's the way we look at it. I think you could debate, and we could easily debate all sides of that issue with equal passion.
Okay. Because it does seem as if we're undercounting significantly. And, if there's a way to address that, I think that we should. My last, the last part of that question is, if we're looking at 5,600 people, 950 of whom are unsheltered. So my question is, for those who are actually sheltered, what can you talk about some of the programs and services that are provided in terms of job opportunities, life skills? I think you went over some of these things and some of your partners before, but can you give us a clear picture? I don't have maybe I missed it, but I don't really have a clear picture in terms of when someone comes in, how do we help them sort of get on their feet, knowing how great the need is? How do we really help them as a city? Are we providing as much as we can provide? Do we need to provide more? And if so, what is that? Can you talk about that a little bit? And I'm asking this question thinking about a shelter in my district that you and I visited, Liz, and one of the things that they were doing was helping folks with savings, like opening up savings account, budgeting, all those kinds of things. It's the skills that we all need, listen, I could use some right now, just sort of organizing and how, just staying organized and on top of things. And so at any given moment, any one of us could use the skills and services and the life training, refresher courses that are offered, but I was really disappointed when I found out that those services were taken away, that they were no longer allowed to be provided to these residents because they don't need the skills, or they don't need the training, or they don't need the this, that, or whatever. And I just thought it was a very much a missed opportunity. So can you speak to that?
Right. I think what you're talking about is mandatory fees and savings that used to exist in the shelter system, which we no longer have. It is most certainly allowed. Yeah, we used to have
mandatory fees.
And yes, the city's shelters used to have mandatory fees and mandatory savings, and that was discontinued in 2016 in part of the effort to do two things. One, become housing first and lower barriers to entry, and people wouldn't come in because they knew that they were going to have to pay fees or have mandatory savings, and they didn't want to be told what to do, and also to be housing first and to be trauma informed. And the idea is that it's really not up to us to tell people how to run their lives. Even though they may have very low incomes, they may be really very, very poor, and they may be homeless, they still have dignity and agency, and they're still people. And so what we have been working with our providers on to be trauma informed is to encourage people rather than to dictate to them. And so that's a philosophical shift. I'll tell you one of the things that really used to help a lot that we don't have anymore, and that's individual savings accounts. There used to be a program, I think it was through the state at one time and through the United Way, where if people saved money, that money was matched. And maybe this also gets to Council Member Dom's question about a ladder up, which is that, just incentivizing savings so that people have a little bit of money. What we found is that when people think they're going to move into a place, they're very good at saving money. And our shelters, I think, and transitional housing programs do a great job of helping people structure their job search or going to school, getting childcare if that's relevant, and also saving money. The other partnership that we've cultivated over the last couple of years is First Step Staffing, which provides temporary, it's a staffing agency. Basically, there's jobs. If you walk in, pass a drug test and ID, you can get a job. And so that has, I think, been a very, very helpful partnership. So all that being said, I think we do put a lot on our shelter staff to try and meet a lot of needs that people have. And, people have a lot of challenges in their lives. And I think that our providers do a very good job. But I think that if we could beef up employment and training services and job placement for the very lowest income people who maybe have checkered pasts, if we could have savings accounts that incentivize saving, I think that those things would really, universal pre-K or Philip pre-K has been a huge help. Those are the things that are really concrete that people need.
Yeah, and I would just add to say, I know when that came out, that was sort of a cultural shock. I know there were many people that reached out to many different council folks' office in regards to that in terms of our providers. I think a lot of that came down to training. I think we probably as agencies could have done a better job in terms of communicating what that really meant, and also provide better training to individuals. One of the things that we did do was went from having a crisis response center by having housing case managers in each individual shelters, and part of their main job was really to create a treatment plan with the individual tailored to them that talked about saving, talked about what it would look like in terms of where would you want to move from different neighborhoods, whether, this neighborhood became a trigger. So I think we still have some work to go in that area, along with providing some technical assistance to our providers. I do know, again, that was a cultural shock because for years, there were mandatory savings and fees, but what we have also found, there have been some providers that have taken on a pilot approach that has really worked, where they have done things to incentivize, such as buying kitchen sets, and people wanted to save money when there were time to move out. So I think we would take any feedback or suggestion on how we can better communicate that to offer training. But I think that is something that's going to constantly be ongoing. And I think the need now even more where income is just not there to really talk about what a savings accounts look like, what it would look like for when you move, when you don't have that safety net, such as some of the shelter providers who go outside of their way to make sure that a person has. I think a lot of that goes down to the language that we use and the training that we need to implement with our provider community.
Okay. I hear you guys. I was unaware of the mandatory fees. I have no idea what fees were charged or, how that worked or where they were charged. But I guess I was specifically speaking of the savings because I am a big a supporter of, the need to save. You just never know. You never know.
Yeah,
right.
And I think, and I understand that we don't want to tell people what to do, but we tell people what to do all the time. We tell them, don't, like this is Philadelphia, don't drink soda, right? Like all kinds of things we tell people what not to do. And so the idea that we can't tell people who are utilizing the shelter system that, savings is a good thing and, that this is something that really should be done. And this is going to help, get that ladder up, get you back on your feet, get you into a place of permanency that is your very own. So I just think that it might be a lost opportunity.
We totally agree.
Based on what I know about the former provider who was providing it, they did a great job. That's all I can tell you. They did
we totally agree with you. We totally agree with you 100% around that savings. And we also know there are banks that are located in neighborhood banks that provide some type of free checking account, savings account for people who are underserved. It's just getting those folks out to come and do some seminars, do some Zoom meetings to really talk to the community about what neighborhood banks also have to offer. But we're 100% in agreement with savings.
Okay. All right. Well, very good. Well, thank you so much. Like I said, I think y'all do a great job. I think this is a point where we probably disagree, but 99% of everything else, I think that you all are y'all are doing great work. So thank you so much, and thank you, Madam Chair.
Thank you so much, Council Member. And good morning, Eva. Can I get you to say your name and position for the record?
Of course.
Madam Chair, I had a question.
Oh, no, I see you. I just... Eva,
I just said, we don't went around the robin and okay.
Council member, I won't bogart too much time. Good morning, Eva Gladstein, Deputy Managing Director for Health and Human Services.
Thank you. I wasn't ignoring you, Council Member. I just wanted to get you. All right, you got the floor. Councilmember Jones, your turn.
Oh, thank you. Thank you so much. And Eva, it's appropriate that you are up to the plate. And I want to thank you, particularly Liz. I remember when it was your first week we met in my office and you were green as grass. You were scared as hell. But you are now battle tested and seem like a veteran of these issues. And I'm very glad that you hung in there with the city of Philadelphia. So thank you.
Thank you.
My question and concern stems from the chairwoman and I were on a bizarre call yesterday dealing with a slightly different issue, but kind of feeds into your premise that is cheaper to maintain people in their existing housing as opposed to matriculate them through a system that can tend to have cost burdens to the city of Philadelphia and then not have all of the positive outcomes at the end of the day. The situation is for multi-unit structures like the Pavilion in my district in the 52nd Ward and the Brish Shalom building, both of which have about a block and a half distance between them, both of whom were built around the same era, both of whom had nice, at the time, HUD deals where there were predictable rents and people got in under locked in rents somewhere around $750 a month. The vast majority of the people in those units, over 300 units we're talking about, are on fixed income. Most of the people in those units are elderly. Most of those people many of the people in those units are veterans. Many of the people in those units have physical disabilities. And what has happened in these cases is that the math of those rents versus what it costs to maintain them aren't adding up. And so deferred maintenance has caught up with many of these facilities, and systems are failing. So we have blackouts where during the heat of the summer, the electricity goes out. There's no backup generators that can, we're already using the backup generators. And we had seniors going down steps using the lights from their cell phones to get down. To say we were risking a catastrophe in those cases is an understatement. So much so that when L&I inspected, they found out that the building, one of them, was in violation of the sprinkler system law, that they had a dry system versus a wet system, which has an additional maintenance cost of maybe somewhere around $150,000, which the management company and owners have deferred over time and just kicked the can down the road. So much so that it wound up in court. And but for the COVID closing of courts, we may have had close to 300 homeless people. Now, how that impacts your system under your theory of how we keep them in facilities, gives me a lot of questions. Now, the chairwoman was on that call dealing with the issue of AMI, area median income, which impacts them as well, because the increases in rent are predicated on the household incomes of Lower Marion, also adjusted to Philadelphia, and the difference might be $45,000 or so in Philly versus $82,000 in Marion, and is pricing affordability rents out of the picture. So I think we, in our housing strategy, need to get ahead of the curve. And these buildings, these older multi-unit buildings that are leaving off of HUD kinds of contracts, are all over the city. They're in Nicetown, they're in North Philly, they're in all parts of the city, and we do not have a policy that is going to prevent the wave of homelessness that comes not just because of COVID rent issues, but because of the deteriorating condition of some of these multi-units. What can we do both for AMI to prevent homelessness and adjust that, and to deal with the condition of some of these facilities?
Do you mind if I try to respond to that? So the AMI question is an underlying one that's a matter of federal policy right now. Now, the city could, and you council could take some steps to try to begin to address it, but the way it's calculated, again, is by federal law, and it's based on a regional calculation. And so the AMI for Philly ends up being much higher than it should be. Plus, the way most developments work, if they get tax credit financing or other financing, they're aiming at people who are 40, 50, or 60% of that AMI. And so the people we're talking about are really at 10, 20, or 30% of AMI. Now, the city does require a set aside of 10% of the new units developed with any city financing. So if 200 units are developed in a year, 20 of them are set aside for very low income individuals. But but what you're really talking about is the preservation issue. And frankly, it's an issue that was raised by the Housing Now protest camp, which I said I wouldn't mention in this call, but here I am, which is that a lot of these buildings were developed under HUD programs with 15-year requirements or even 30-year requirements, and they're coming off the requirements. I just saw the most recent information from Planning and Development, and they're looking at significant investments in preservation. And that's what the need would be in these buildings, is preservation. And if you have a responsible nonprofit owner, they would go after that funding, and they would put in the money for deferred maintenance, and they would agree to extend the low income affordability. But in some cases, you don't have an owner that meets that designation. But I would encourage, I think you're going to be looking at this, at some additional CDBG investments to kind of talk through preservation, because for people who are in housing that was developed with federal housing funds or low-income housing tax credits in the city of Philadelphia, you're right, keeping them in their units would be the highest priority. And the city does on a routine basis make funds available for preservation of those units, which could involve city financing, could involve going and getting more tax credits of two different varieties, but you need an owner who's willing to do that and has an interest in doing that.
So I would join my skeptical colleagues about gentrification. I would join that whole mindset of you better watch out because they're coming to get our property. I would suggest to you that when you talk about these two facilities, a block away from Fairmount Park, 2 or 3 blocks away from City Avenue, 2 or 3 blocks away from the expressway, can get anywhere in the region within 20 minutes. That there is a wish by some of these owners and managers that we actually do go after them in L&I, shut them down, put the people out so that they can then renovate and slickly market to a whole different segment of renters.
Yep.
If you don't believe that, Jones might be paranoid up in the 4th because this only happens in the 5th district and in the 1st district and in the 3rd district. Gentrification issues no, because all you have to do is look at the Penn-Wynn scenario, and now it's called the Dane, right? Same place, but almost double the rent, and with a different clientele. We developed the good cause legislation because of that growing scenario in not Center City adjacent neighborhoods, but in the 9th and the 8th and the 4th districts. And so we're beginning to see investors out of New York often that are coming in and seeing the value in these structures and scooping them up. So in our affordable housing plan, as we move towards budget, I'm going to be looking for programs that specifically address that growing phenomenon. So I mean, that's important to me as a district council person who is on the fringes of some of that gentrification. Thank you, Madam Chair.
Thank you, Council Member. Council Member Brooks.
Thank you so much, Madam Chair. I have a series of concerns and questions that I'm gonna bring up. I'm gonna start with in the housing system. I was recently told that there has been a significant number of Black men that have been hard or for some reason have not been able to be placed in permanent housing. And my concern is leaning to something my council member brought up. We have folks young men that are aging out of foster care system or aging out of the criminal justice system through foster care or whichever way that goes back and forth that continue to add to the large number of young Black men that end up in shelter. And you even also mentioned about, the systems aren't aligned. So people are coming from prison, don't have a shelter plan, they end up in our shelter system. What is being done to make sure is equity or whatever supports are needed to be put in place for, Black men that are falling into this system? That's my first question.
We just, and I'll defer to Beth. She may have a more comprehensive answer. We just completed a racial equity analysis. We did it last year. It's been updated this year. And the vast majority of people who access permanent housing are African-American men. So that there is no disparity that we've been able to find in that. That being said, Council Member, there certainly is not enough places for people to go and for people to live. And I do think that young adults struggle more. They're energetic, and I think that that's why we've tried to grow the supply of options for young adults, and so that they have more options. And this is I think this is a multi-system, and this is a more complicated issue because it has to do with the education, employment, right? All of those things so that people not only have a future, but they feel that they have a future. And I think one of the most insidious evils that we have is when young people, especially young Black men, feel that they don't have worth and that they don't have hope. And then they turn to the economy that's available for them in some cases, which may be K2. And so then you begin to lose them. And so that is an urgent issue, I think, for all of us to look at.
Are there any collaborative conversations that are happening to make sure as they transition out of whether it's criminal justice system and the foster system, that they have access to workforce development or some way to earn a sustainable living while they're transitioning or once they hit the shelter? Or is there a collaborative conversation between all of these city agencies to make sure that there's a solid transition or pathway for these young Black men? Because we realized we ended up with them again when we start talking about violence preventions in neighborhoods and so many other things.
Yeah, I think
you're absolutely right. One of the, and I hope that you will talk to the correctional system and the child welfare system about these questions also, and not just us. And we do certainly are in very close dialogue with them. We've just worked together with the correctional system. We have 2 pilot programs. One is called High Five, which is for people who have mental health, have been homeless in and out and been through the correctional system. It's a subsidy with wraparound services, and it's been extraordinary. It's an evidence-based practice that's being used nationally, and we're getting extraordinary results. They're not going back into the correctional system. And with the reentry office now, there's a new program that's just been funded to provide rapid rehousing through a master lease program so that when people are coming out of the correctional system, they have some place to go right away that's not a shelter. So those are some of the collaborative efforts that we are undertaking. I think that for example, the correctional system, they're just like you're asking us to stretch and look across bounds. I think that the question of what are we releasing people to is a question that other systems are asking and need to look at. And how does that fit together with affordable housing so that people do have real options in their lives to be able to exit to? Dave was going to add something.
Yeah, I think, Liz, I think you're correct. I think it's we have had numbers of conversations with Commissioner Blanche from the county jails, but I think it's extremely difficult, and I think this is something that you probably have to do with your legislative counterparts at the state. But when folks are being discharged from state prisons and don't have a discharge plan or having some communication, you know, unfortunately, you have a lot of people that are being discharged from state prison, especially particular Black men that are entering into shelter, which we have, you know, that relationship or that having that leeway is extremely difficult. I think at the county level, we have had conversation with Commissioner Blanche in regards to identifying folks who come in that says they were homeless, that has behavioral health challenges, and we kind of can work with them on sort of a discharge plan. But it's that issue where folks that have been doing state time when they're being discharged, and unfortunately, some of their housing option plan is the shelter system. I know we get significant amount of letters that come from state social workers, and their housing option plan is they still put 1360 Ridge Avenue shelter on there. That just shows how much, you know, there's been a out of touch point, because Ridge Avenue shelter has been closed for years. But unfortunately, some of these state prisons still utilize folks who have been identified, who have been born and raised in Philadelphia, and when it's time to be discharged, unfortunately, shelter is the only backdoor option. But usually we get that maybe 30 days out or sometimes less than that. And we just don't have a way. Maybe that conversation, again, needs to happen at your level with a state rep that really is engaged in that process around re-entry back into society. But again, we would love to be at the table, have a conversation around that.
So when I think of reentry and reunification, I remember, so we're talking, this is all the same issue. When we're talking about families that may be in public housing voucher system and men returning back into families, is it still on the books that they cannot come back into their home if they're receiving public housing? If they live in any public housing or city-funded housing, that someone coming out of prisons cannot return to their families?
We do not have a prohibition against people with a criminal background in anything that we support. And I don't think HUD does either. The only prohibition, I think, in PHA federally is if you've been convicted of burning meth, especially, or a capital offense like murder. I think other than that, PHA has a slightly more restrictive policy. This is something you'll want to ask them about when, when you have them talk, because they have a slightly more restrictive policy. And so what we do is we help people appeal if they are turned down for housing.
And I guess they would have to also, you have to probably go back to whether they were listed on the lease at the time when they went into PHA housing. So I think, again, that's a question for PHA, but I have heard that comment also before on many different occasions, but I think it really goes down to who's listed on that lease.
And council member, though, I just want to affirm your question, because I think when we look at homelessness, people usually think about mental health. And a lot of people who are homeless are perfectly mentally healthy. They just don't have money and they don't have opportunities. And I think one of the things that really holds people back is this whole churning through the carceral system, and the fact that people end up incarcerated very early on, disproportionately Black men, young Black men especially, and then it's like a ball and chain and they can't move forward in their lives. And so I think that anything we can do for employment, for housing, that reduces discrimination based on, your past record would be very helpful for them and for us to be able to help them.
So I'm going to switch gears a little bit. I have a few questions about rapid rehousing. I'm really excited that this is available to folks. But one of the things that we found is that how someone talked about incentivizing landlords to do this. So there are some landlords that are willing to do it, but at the end of the 12-month or the 24-month lease, they create unreasonable leases for people to stay there. And that's not a pathway to permanency. Is there any way that we can secure, the city is securing funding for 2 years for a property? Is there something that we can do on the tenant side to ensure that they're still able to stay there once their lease agreement with the city is up? Because I've had several complaints about that particular issue. And I think that's problematic when the city has secured a landlord 2 years worth of income at probably top dollar rate, where at the end of the day, we end up with the same people back in our system after we already made the investment.
In some cases that does happen. And I think it's a good point. And I think you actually I think council has done a lot to try and hold landlords accountable in general. Once we stop paying them, then that becomes a legal issue of whether it's a legal lease and whether people know how to negotiate. What we try to do is really work with people on what are their rights. We try to work with a model lease so they know this is what a lease should really look like. You can't sign away your rights. You can go to the Philadelphia Eviction Prevention Program if you think you're being treated unfairly. You can go to TURN, and you can get help and you can fight for yourself. I think what we do, or what we try to do, is to help people feel empowered to advocate for themselves if they are treated unfairly.
And to that, when I think about pathway to permanent housing, we realize that some of these landlords will gladly take city money, but give independent or folks that I'm saying we're in terms of the homeless system, trying to find housing for folks. Housing discrimination exists. And it's really hard to find folks that are willing to, not just to take the city vouchers, but just regular PHA vouchers or whatever. Is there any way we can, or do you see any pathway that we have to secure long-term housing for tenants around this particular issue, because we know it exists?
Well, you're right. Housing discrimination absolutely exists. And the city actually has source of income protection, which is a higher bar than the federal law, and I believe than the state. So that step has been taken. I'll tell you one thing, there's two things that have made a difference for us. Landlords, when we did the eviction task force a couple of years ago, one of the things that was loud and clear is that landlords hate risk and they need money and they want a steady stream. Like turnover in units is one of their highest costs. So they don't want that. And so one of the things that we've done in our programs that's very helpful is to screen tenants and then stand behind our tenant. So it reduces the risk and it reduces the cost of turnover. The one thing that I think would really help is if we could help more of the mom and pop landlords fix up their places. Because when you get a subsidy, it's enough to cover your operating costs, month to month, day to day, your property taxes, whatever your repairs, your carrying costs. But it's really not enough to make major capital investments, like if your heater, your boiler, your roof, your windows, if those things go, even if you're on a program where you get a rent subsidy, it's really not enough. And I think that one of the things that we've tried to pilot, but still I think very much is needed, is some kind of loss reserve fund or some kind of loan or grant program, especially for those mom and pop landlords. Philly is a city of mom and pop landlords. Most landlords own 1, 2, 3, 4 units. They're not mostly the high rises, although we have that. And they're really scraping by. And so those are the folks I think where there's really an opportunity if we could help them with loans or grants to make major capital improvements so that they could, and with some strings attached, so they have to continue to make it affordable to somebody at, a low income. I think that's an opportunity that we could look at that would make a difference.
Eva, it looks like you wanted to say something.
Yeah, just to say that there's a pilot program in the Kensington Lower Northeast focused on doing this. It's a loan program, not a grant program, where we got some state housing trust fund money and then planning and development put in some resources, and it's Impact Services is operating it, but it would enable landlords to make all of the repairs, particularly for properties that have some lead issues in them, and then hold them to certain lease terms and terms around rent for a period of time because of the city investment. So that probably only kicked off maybe 3 or 4 months ago, but I think we could look at that pilot and see what we can learn from it.
Yeah, I think they were called rental repair programs. Their HUD used to have a product many, many years ago, but I think that's the idea.
And the city had a product called the Men Program and Men 1 and 2, but they've been long gone.
Okay, so my last thoughts around this issue. When we think in terms of the rental assistance and the programs that the city has already set up to help low-income renters, do we have any rent stabilization measures in place for properties or for landlords or realtors that we continue to invest in towards housing? Because we realize that we are spending taxpayers' money. And rental assistance is wonderful for renters, and it's also wonderful for landlords. It's guaranteed income. But long-term, it's important that if the city is making an investment in good faith, landlords are doing the same. So regardless of what you want to call it, rent stabilization, rent control, or whatever, if the city is funding these programs, is there any way or things that you think would be best suited for us to provide as much housing as possible at low costs, right? And get as many of people housed. And I think moving towards some kind of rent stabilization or whatever someone wants to call it would be a smart move. Have you guys thought of any programs, or are there any situations where those type of stipulations are within contract with landlords?
Yes, there is. And I'm just laughing because both Eva and I worked for the Tenants Action Group for many years. And this is a thing, something we've thought about and talked about for, 30, 40 years, something like that. But to answer your question, our shallow rent program that the Office of Homeless Services runs is a set amount of money. We pay $600 a month. The individual pays $200, and the total nut is $800 a month. And so essentially through that program, we have, does function essentially like a rent stabilization program. The trade-off is then there's no turnover in the unit. It reduces the risk for the landlord. And so we have had very good participation in that program. The wild card is if you end up having a low vacancy rate in your rental market, then landlords will gravitate towards higher rents, just like Councilmember Jones was talking about. Or if they think they can get the PHA subsidy, which may be higher, then they may pick and choose. They may cherry pick their rental assistance program. But our shallow rent program is a set amount for the duration of the lease, which is renewed annually. So it is a de facto rent stabilization, a voluntary rent stabilization program.
So can we have some uniformity into this between PHA and the city?
No, we can't without changing federal law. Because the way the housing choice voucher works is that you pay 30% of your income towards housing costs, and it's based on what is considered to be the fair market rent for the geography. That's what Councilmember Jones was talking about, whatever that number is. And so it's basically indexed based on the market, whereas the shallow rent that we do, we've basically tailored it. So it would require some kind of adjustment through PHA. Now, whether or not they could do it, they're moving to work agency maybe, or whether or not there's any flexibility there, I don't know, but I don't believe without changing federal law that could be done. It would have to be purely voluntary. It would have to be incentivized, I think.
Madam Chair, I have one more thing just to that. When we think about the rent assistance that came out in reference to COVID, I had significant number of applicants on the tenant side that had landlords that refused to do it on their sides for whatever odd reason, whether they didn't want to take the original $750 that was offered, whether they weren't in line with their own property taxes or had L&I violations. And I know that the city was working really hard to help the landlords on that side as well. So I'm thinking in terms of, we're saying that landlords like consistency And through COVID, the city has stepped in and offered that level of consistency through rental assistance, and they refuse to take it. I'm not really sure what else we can do moving forward, even though I know that subsidy was increased because we were able to add federal funds, but it still was only for 3 months. COVID has yet to end. And the concern is what's going to happen for the duration until people are 100% back to work. Do we have any idea of what can be put in place, or any idea what we can do for the next few months to secure tenants and also incentivize, I don't know what else, we're giving them the landlord's money to keep the tenants in those houses or units to prevent the homelessness that we anticipate due to this pandemic?
Well, I think again, council really deserves a lot of credit for all the steps you've taken with the eviction moratorium, with the diversion program, with the eviction prevention program. All of these steps that have been taken, I think, are the right things to do, and that's what we know works. Above and beyond those things, I don't know, I'll defer to Eva on this. I think sometimes landlords don't participate because they don't have rental licenses and they want to fly below the radar screen because they don't want to be known as a rental property, because then, it's more of like, I'm going to overstate this, but like a black market among renters, among certain landlords. So they don't want to participate because they don't want to be held accountable for the standards, and they prey on people who don't have a lot of choices, and we know that that's a big issue, and so we understand that, and sometimes they're scared, sometimes it's too hard, who knows what other reasons they have, but I think probably continuing to get that money into rental assistance and continuing to not have evictions and provide that assistance to tenants so that they can fight if they are being unlawfully or unfairly evicted. Those are the things, they're very labor intensive, but those are the things that work.
One other thing, this is more of a comment than a statement. One of my pet peeves, and it has been my pet peeve even prior to becoming an elected official, is how we use affordable housing interchangeably. And we realize when we talk about AMI, we're talking about folks that qualify for affordable housing work in our offices, right? When we're talking about folks that are at 10%, that is low income, and we can't use it interchangeably because the systems that will keep them in place are not the same. And the availability and access to housing are not the same, because people will gladly allow affordable housing in their community. When we start talking about low income housing, we start talking about discrimination, and we have to be able to articulate that in a way that everyone understands. And I'm excited about the tiny house program, and Councilman Dom talked about these modular programs, which are all good, but I do not want the city to really be invested in new improved public housing in the long term will end up neglecting and divesting in, and they end up becoming slums all over again. We need to find a better way to invest in our citizens, whether they're low income, affordable housing, or newcomers coming into the city. Everyone deserves quality housing, and I think we need to find a way to look at it that does not segregate people, because that's what we have done historically, and that's what we continue to do, and we have to find a better way to do it. So we don't want a new and improved public housing system. We need to find a way to provide housing for all citizens in a way that Philadelphia becomes, an example of what it is to be, a city that cares about its folks. What? The city of brotherly love, our name. How about that? Thank you, guys.
Thank you, council member. Very well said.
Thanks, council member. Council member Gim.
Thank you so much. And again, I want to echo, many people's comments about expressing gratitude to Liz Hirsch, to Eva Gladstein, and both of you for your advocacy. I'll be quick because I know this has been a long time, and I also want to thank the chair of the committee for allowing me to ask questions. I'm not a member of the committee, but have been very deeply appreciative of this committee's work and believe it's one of our most important committees right now. So Liz, I think you had mentioned that that there was not a ton of overlap that you saw between evictions and homelessness. Is that right? Or I don't want to mischaracterize you.
What I said was that our numbers indicate that 20% of those who entered our shelter, and I believe this was FY19, had been evicted. The vast majority of people, and so we are sending them now to PEP and to the eviction prevention, the rental assistance program. The vast majority of people who come into the homeless system are not leaseholders, current leaseholders. Mm-hmm. It doesn't mean they may not have been evicted some time ago, but often they're young and they're just leaving a family house of some sort or a system, or if they were leaseholders, it's not within the recent past.
Mm-hmm. And then if of the ones who do come in who are leaseholders, would you characterize them as women or family members? Are children involved with those?
I don't have that data in front of me, to be honest with you, council member, but I'm guessing that they're families. Yeah. Generally speaking, what we see is a young parent when the second child shows up, or when the child gets to be a certain age and the place becomes overcrowded, or there's a job interruption, all the usual reasons that people, lose their housing. They don't have enough money to pay the rent, that kind of thing.
Mm-hmm. And I think you said that you've seen a decline in the number of families currently seeking shelter. Is that correct?
That's correct. 25% from 2017 to 2020. Yeah.
And I'm curious about whether you've seen more, obviously, as you know, since March, and I thought I heard you say something about March, but since March, we've had an eviction moratorium in effect. It has meant that there are no current lockouts, legal lockouts, that is. There might be illegal lockouts, but there are no current legal lockouts since March. And I'm wondering if it's possible that has something to do with, not seeing as many families and children in particular coming through our shelter system.
Yeah, I think that's quite possible.
And
that's why we're so scared of what's going to happen next. If people don't have the assistance they need, either income or rental assistance or eviction prevention, what's going to happen?
Mm-hmm. And we are currently discussing. The CDC has issued a statement that they want a nationwide eviction ban, especially on anybody who earns less than, actually it's $198,000 per household. So it's a significantly high number, or $99,000 per individual, but in part because they see mass evictions as a threat to the public health, including if shelters are to get packed or if people were to go to the streets. Yeah. We're obviously debating whether the extension of a local Philadelphia-based eviction moratorium would help strengthen and clarify things for landlords. And I'm wondering if you have an opinion on that.
I agree.
With a reinstatement or a local eviction moratorium that clarifies.
Yes.
December 31st. Yeah.
Yeah, the pandemic is still raging.
Thank you. I guess I know that Councilmember Brooks had asked this, but it would help to hear if you could get specific about numbers. How much in rent subsidies through the CARES Act money has gone into rent subsidies from March until now? And do you have those numbers from your shop?
Yeah,
I know that
yes.
Eva has some as well. So I'm not sure how the CARES Act money gets clearly distributed, but I don't know if you have an aggregate, if you have a subset, or how it functions.
Well, the answer is zero. The CARES money didn't come to us. We got the grant agreement in July. The ESG money actually runs through DHCD. They're the grantee, and we did not get a grant agreement. As you recall, Council passed this substantial amendment to the consolidated plan, which is the trigger for getting the grant agreement, which we got. Then the next step is that all of the billing systems and the categories have to be set up in the HUD system in order to begin to draw down money. So at this point in time, that's still what's in process. So we have not actually received any money yet.
So there's $0 of CARES Act money that has gone into, I think my question is that has gone into the rent subsidies that were provided between March and up
No.
to now.
No CARES money.
No, from the Office of Homeless
The
Services.
services, no.
Right. So the two tranches that were run by, I'm not going to get this exactly correct, but by the Redevelopment Authority, I think that they use CDBG CARES for the first one, and for the second one, obviously, it's they may use multiple sources for the first one, frankly, but that's one source I'm relatively confident of. For the current one, obviously, there's state CARES dollars, and they're putting on top of that some of the CRF dollars, right? The Coronavirus Relief Fund dollars on top of that.
Okay, so but that is not CARES Act money. The relief fund is not CARES Act money. Is that correct, Eva?
You know, I don't know how to characterize it. I'm not 100% sure, council member.
Okay.
Yeah. Once we start, we do have a budget and a spending plan that we're working from. So once we start to draw down money, we will track how much is going into rents versus other costs.
And I think that was my next question. As we take a look at the fact that the municipal courts intend to resume lockouts starting October 7th, is there a plan, or do you have an amount that we can discuss about whether any CARES money or additional funds can go into the next few months to either provide money at point of diversion so we can avoid eviction as opposed into a general rent subsidy kind of pool?
And there are active conversations going on with the Recovery Office about that. But I think there's also a little bit of a wait and see game to see whether or not because the state rental assistance funds have not by any stretch of the imagination been totally used, given the restrictions on that program and the kind of the artificial deadline of September 30th, which I know is tomorrow. But since the state legislature is looking at amending it, and one of the amendments would be to extend the deadline until October 30th. So I think other folks in the city that are managing these funds are trying to pay attention to what's happening at the state before we put local dollars in. But I think that there really is, a desire to have some resources beyond this week for rental assistance.
Yep. All right, that's very helpful. Okay, so I think that there are a couple of quick questions. Liz, what is the number of occupied beds versus available beds in our shelter system right now?
I haven't looked at, the numbers would have come through to me today. In the single side, yesterday, I think we had about 40 beds available. On the family side, I think we have quite a few beds. I would say maybe 200, something like that. We could open up more beds. We've been very careful because we're trying to make sure that we don't spark a COVID outbreak. So we're trying to keep them as sparsely, not as sparsely filled, but keep social distancing in place. And also as the weather gets colder, our numbers always go up. But I'd be happy to provide you with those numbers today, later on. But that's, I think, the single side, we're at about 90%, and the family side, I think we're at about 80% right now.
Okay.
And remember, I'm sorry.
Oh, go ahead. Eva, go ahead, please.
I just got an email clarifying the answer to the question was that it's all considered CARES Act funding because the different pots came down, with different names on it, but everything was authorized under the CARES Act.
Okay. All right. Thank you. And then, Liz, just for a little bit of clarity, you say that currently there are 200 available beds. Or is it 240 available beds? I think you said 40 on the family side, 200 that are available. So I didn't know if that was one number.
Other way around. I think there's about 200 family beds. And because our family shelter numbers, as I mentioned, are down. On the single side, We've been running at about 30 or 40 available beds for singles on a daily basis.
Yeah, it's about 148 family beds available, 36 single men and 79 single women.
Okay. And then in terms of like programs and services for women, particularly those who are heads of household who have children involved, what's the availability for that?
That would be the family units.
That's the family.
Okay.
Yeah. And it's not just mothers, it's also fathers,
right,
or guardians or caregivers, whoever, however the family defines itself as a family.
Yep, we understand. And I think a little bit of what we're saying is that what we're seeing through our eviction data sets is that the overwhelming impact is on single female heads of household in particular. Yep. So,
I think, as we know, council member, that when Matt Desmond did the original work on eviction, he actually characterized mass evictions, probably 5 years ago now, mass eviction as the Black female correlate to mass incarceration for Black men. So we know that African American women are disproportionately impacted by eviction.
Yes, thank you. And then are there, I know that you had mentioned earlier with Councilmember Bass that there might be a reduction in the number of available family beds. Is that right? Because of the potential closure of those two, or the repurposing of those two shelters?
Mm-hmm. Yes.
And is that based on the fact that there's availability, despite the fact that we've got a moratorium in place, which may be impacting numbers, right? Like what I wanted to understand was whether that was a long-term movement towards that. Obviously we feel like this stage with the eviction moratorium is very fragile, and should the courts begin, we assume that we estimate about 2,000 immediate lockouts that could be in the hands of a landlord-tenant officer in a matter of, days effectively. And then we've got more that are being scheduled, and 1,000 plus that have already been filed since September, when people started filing. Is there some thinking about what our capacity might look like given the fragile state of the situation, rather than assuming that family beds are may not be as needed?
Yes, that's one reason why we're not moving precipitously. That's why we are really trying to manage this balancing act. We don't want to have an oversupply of beds because that money could be repurposed in theory. And at the same time, because we don't know what's going to happen with the eviction moratorium, the unemployment rate with the pandemic, we really feel that we have to keep all of our options open. Some of this also for us relates to what you can use which pot of money for. Unfortunately, it gets to Councilmember Brooks' question. And the ESG money that we have, that's the biggest source of money that we have right now, cannot be used for eviction prevention or eviction defense. So we're in a little bit of a tricky balancing place with that.
Mm-hmm. Okay. Could you talk a little bit about what kinds of services do you have available for people with disabilities?
We have, as I mentioned, we're an equal access system. We do have a substantial number of people in our system who have, are you talking about physical disabilities or behavioral health disabilities?
I think you could help me by explaining what you have on physical disabilities and those with, behavioral health. Mm-hmm.
Oh, well, we do get a fair number of people who have either physical disabilities, who are in wheelchairs, or who have significant mobility issues that make it very hard for them to function daily in a shelter. And so I think last year we served between 500 and 600 people who had either mobility issues or were in wheelchairs. There is a program called this catchy name, the Section 811 program, it's a federal program that does provide accessible units for people. And so we actively, we do everything we can to get people into those units. Most of those referrals come from Liberty Resources. And then we also try to get people into affordable units that are accessible. And there are some PHA units that are accessible that we are able to access. But the fact of the matter is that we do have people in our shelters who have physical disabilities, and it's a crime and a sin. I don't think anybody who's elderly, I don't think anybody should be homeless, but for people who are physically disabled or elderly or mobility impaired, to be in shelter is just, it's really unacceptable. We do allow people to come in if they have a full-time aide and the aide is accommodated. So we do have folks in those situations as well. On the behavioral health side, a lot of folks have behavioral health challenges, or as we like to say, being homeless is crazy making. Sorry, forgive me for being politically incorrect. The higher incidence of behavioral health, specifically serious mental health, is more on the single side and more on people who are unsheltered. And just like we've seen half the people in the COVID prevention space come from the street, very often people have a serious mental illness, really can't live in a congregate site for a variety of reasons. And so being able to help them get into a place where they have a little privacy and can get the care they need is very effective. So I don't know if that answers your question, but
I think it's an ongoing issue.
It is.
One of the things that we've been trying to do is try to, especially on the DHS side, is leverage the power of our dollars to require, providers, especially those who receive public subsidies, to do better. I mean, just out of curiosity, and I'm sorry because I'm relatively new to the world of affordable housing and not as quite familiar with like physical availability and, what qualifies and doesn't qualify. But in general, like if you have Section 8 housing or PHA contracts with, particular providers, are they required to have all their units be, accessible units rather than as like a set aside specifically that would be limited to people with particular disabilities, whereas like it just seems that we would try to be expanding the pool of available housing that is accessible to everybody regardless of ability, so that anybody could move in and we're not just kind of like being hyper limited or having it be like an issue of scarcity.
Right. No, I agree.
I'm sorry if I'm like if I'm asking something that's pretty basic, but
no, I actually don't know what the rules are at this point in time for the housing choice vouchers or tax credit funding. I know they are required to have a set aside of I think 20% of their units for quote unquote special needs, but above and beyond that, I actually don't know what the answer to that question is.
I mean, like, as I said, I think it's important for us as a city, particularly because we have an anti-discrimination law, because we've got so many people who are in need, to try and do as much as we can to both send the message that providers that have fully equipped residences that could be available for people regardless of ability needs to be a strong message that we can send if we're ever going to have a shot at like housing truly vulnerable communities and families, multiple people, whether they're seniors or veterans or young people or across the spectrum, that we really need to do that. And then I think that those are most
I agree.
My questions. Yeah. Thank you so much, Madam Chair.
Thank you so much, Council Member. Are there any additional questions or comments from members of the committee? Great. There being none, Mr. Weiss, will you please call the next panel or witness to testify?
Modesto, could you call in the folks who've signed up for public testimony?
Modesto?
Hello.
Hi. Good morning.
Hello.
Yeah, we should have Marta Gottenberg online.
Okay. Can you please state your name for the record and proceed with your testimony?
Thank you very much. My first name is Marta, M-A-R-T-A. My last name is Guttenberg, G-U-T-T-E-N-B-E-R-G. I believe I'm the only person not already a member of a service organization or council who signed up to testify today. And I was surprised to learn that. As I waited on hold, I remembered the phrase, "nothing about us without us." And I'm aware that, as near as I can tell, I have listened since the beginning, there has been no direct testimony from actual homeless people. It's been about homeless people. I understand that this is the first hearing. I know that the homeless encampment has a standing brunch invitation out to the mayor. And I'm sure that if people from council wanted to have brunch at the Parkway site, they would be accommodated also. And it might be an important way for the people actually affected to be able to more directly inform the council them in a nice way. And I understand that everybody is well-meaning and wants things to be better. The visual I had of this conference was of people making bandages for a war and discussing how little gauze they had and how they could stretch insufficient gauze to cover gaping, bleeding wounds. And I would also like to say that the overall method that the city has for thinking about housing is exactly anti-Robin Hood. It steals from the poor to incentivize the rich, to gentrify and maximize. I believe that there are ways that the city council can really work to prevent the strong anti-Robin Hood system. For instance, if city council would simply hold people who have taken city, state, and federal money to build affordable housing and then don't do it to account. If city council would abandon the tax exempt status or the tax abatement permitted to people who are actually very rich and don't need it. I think I'll stop with that. I don't want to hurt anybody's feelings, and I hope that you will accept these words as not personal criticism, but systemic criticism and an effort to point City Council to where it can do its job. I'll take questions if people want to ask me any.
Thank you so much for your testimony and your critiques. They're important. I've been to the encampment several times, as has Councilmember Brooks. But I take your point that we have to be highlighting the real lived experiences and stories of people. So I'll do a better job next time of making sure that we include that and give it space. Are there any questions or comments from members of the committee for this witness? There being none, Mr. Weiss, will you please call the next panel or witness to testify?
Modesto, I'm not sure who you can bring on next, but Scout Gibson, David Fair, Sterling Johnson, and Jennifer Bentek.
Okay, we have Mr. Sterling K. Johnson online.
Okay, good afternoon. Can you please state your name for the record and proceed with your testimony?
All right. My name is Sterling Johnson. I'm with the Black and Brown Workers Cooperative. I'm a lawyer who have 10 years of experience supporting people with disabilities, HIV, substance use disorders, mental health disorders, as well as just people that are low income. Personally, I identify as a person who uses drugs. I've been in mental health recovery for a time. I work specifically with Philadelphia system for the last 7 years. And I have been worked at the social service agencies, but also legal services agencies and around housing. So I see a lot of the different issues and how they affect each other. So I'm currently with the encampment that is at the Ben Franklin Parkway. I'm currently negotiating with them, with the city since June 10th. The people there have been organizing in their own rights. So I don't want to say that I represent every single issue, but I've been a lawyer that's supporting basically the people there communicating exactly what they want. A few things is that, just the policy must be in all homeless service providers. That's not the case right now, especially with the major ones. There must be a focus on permanent housing solutions. Community land trust was the demand that we had, the first political demand that we had at the encampment. We need to enforce discrimination laws, especially source of income, racial discrimination, as well as evictions and criminal record discrimination that occurs. Those are just proxies for racial discrimination in our cities. We must force hospitals and prisons that actually have discharge policies are not the shelters and not to the street. They need to be held accountable for all the harm that they do. We also must use the money that's currently used for homeless sleeps and other, including the police interaction with people that are unhoused. We must use all of that money to actually support the people that are on the street. And that means making a sanctioned space, whether it's actually sanctioned and managed by a service provider of some sort, or just a space for amnesty that allows for people to be, so they are not being pushed and moved around all year. So in general, those are the points that I want to hit. I have testimony in here. I feel like some of the also important facts that are out is that we actually need more hotels. This is something that I said before. We need to hold private people accountable with a 40% vacancy rate in the hotels. There is space for people to be. Private developers in general just leave properties available in our neighborhoods, as well as the PHA, even our nonprofit housing developers. They evict people constantly from their spaces as well, and that's how people end up at our encampment. They are evicted from spaces, whether officially or unofficially. They are told that they should not be where they're at. Even when we attempt to put people into the homeless service provider network, those spaces evict people. I personally help people. I work with Liz and David as well to get people back into a shelter, get people back into a safe haven. That is the work that really is unnecessary. There really does not need to be a summary discharge policy that happens from every service provider that then allows them to be back on the street. The amount of people that have been entered into services from our encampment is not 150. Maybe they entered that many people, that they may be double, triple, or quadruple counting people because they've exited and then they've had to be placed back in, or they're still at the encampment. So when we're talking about what are the issues that need to be done, I will stop right here and say there are significant barriers to people staying in these spaces. Whether it's just the carceral nature of them, it reminds people of being in jail. We cannot have tiny jails in our systems. Traditional large suppliers of housing or recovery housing like Project Home, one day at a time, they can't have carceral systems that make people take constant drug tests, that basically surveil people, that question whether they have guests. There are no guest policies. There are curfews on different spaces. To treat people, grown adults, 30-year-old people, 40-year-old people with curfews is offensive. We have to understand that we cannot create basically a small prison and expect anybody to stay in it. And then we count those as permanent housing solutions. That is wrong. That is wrong. There has to be a network where you are actually talking to people that are unhoused. And we're not talking about the unsheltered housing group that has a bunch of business people on it. That needs to be abolished. You need to be listening to people that are unhoused. That is the only solution. There are no other solutions besides actually supporting people that are unhoused and actually do it. And also, just lastly, there's 60,000 households that earn less than $10,000 a year. We need to actually understand that need and meet that need and stop exclusionary zoning policies. Exclusionary zoning policies are things that white supremacists do. That is not what we should be doing. Any exclusionary housing policy needs to be stopped right now. Councilmanic prerogative really has to be questioned and abolished, because we see that is what causes our current situation. And please understand that it is not an accident. It really seems intentional if you do not actually stop. And that's what is actually required of you under the AFH. We have another administration.
Can I ask
you will be sued for that.
Sorry.
I have wrapped up, but the assessment of fair housing, again, go back to it and says you have to intentionally stop housing discrimination. That is not what is happening now. Thank you.
Thank you so much for your testimony and for your advocacy around these issues. Are there any questions or comments from members of the committee for this witness? There being none, Mr. Weiss, will you please call the next panel or witness to testify?
So we've got David Fair and Jennifer Bentek left.
Hello?
Hello, hi. Can you please state your name for the record and proceed with your testimony?
My name is David Fair, F-A-I-R is my last name. Good morning. I thank you for the opportunity to provide testimony this morning on behalf of the Philly Homes for Youth Coalition. I am Deputy Chief Executive Officer of Turning Points for Children and a co-founder and former co-chair of the coalition. I have submitted more extensive testimony that I ask you to review. A recent survey by the Field Center at Penn reported that among youth in foster care, 43% reported COVID-19 having a negative impact on their living situation. Over 7% were living on the street at the time they were surveyed. In August of 2016, the Youth Point in Time count counted 569 homeless youth between the ages of 13 and 25 in Philadelphia. And a survey conducted by the Philadelphia School District of high school students found that over 700 older students reported being homeless for at least one night in the previous year. We're sure we don't need to tell you that youth homelessness is a crisis for the Philadelphia community, and it's one that has only worsened during the pandemic. At a time of increased understanding and recognition of the special challenges facing disenfranchised community, it is also important to recognize that most homeless youth in Philadelphia are Black and Latinx, and a large percentage of these young people are former foster youth and LGBTQ youth. Since 2016, the 33 organizational members of the Philly Homes for Youth Coalition and our youth members with lived experience of homelessness have played a leading and essential role in developing and implementing the city's efforts to reduce homelessness among youth and young adults. The role of the coalition in this area was codified in 2018 in the Office of Homeless Services Roadmap to Home Strategic Plan. Until the end of fiscal year 2019, this effort was co-facilitated by an OHS Youth Homeless Coordinator, along with co-chairs from the Young Adult Leadership Committee and the provider agency. When the OHS position was suddenly eliminated last year, and recognizing the ongoing role of the coalition in developing OHS's youth homelessness prevention strategy, OHS agreed to provide 1 year of funding to support a part-time coordinator to provide administrative support to the coalition. It was expected that during fiscal 2020, the coalition would seek additional funding sources to support its activities going forward. Unfortunately, the sudden loss of the support of the OHS Youth Homeless Coordinator interrupted the processes of the coalition early in the fiscal year, leading to several months of reorganization efforts, and the efforts to raise funds to support the coalition activities were unsuccessful, largely because of the priority of supporting COVID-19. Attached to my submitted testimony is an extensive list of the goals and accomplishments of the coalition in its short history. Today, the coalition asked City Council to reaffirm the earlier recognition of the coalition as a formal partner to OHS and the City of Philadelphia, with the role of facilitating collaboration among agencies and integration of efforts to end youth homelessness in the city government, as contemplated by the Roadmap to Home Strategic Plan. Further, the coalition requests that the council recommend to OHS that it provide annual funding to support the coalition's work each fiscal year. These funds are needed to support a full-time coordinator, provide financial support for young people with lived experience to continue to exert leadership in the coalition's work, and advance efforts to raise funds from other sources to support the coalition's work in the future. Thank you for your kind attention and consideration.
Thank you so much for your testimony. Are there any questions or comments from members of the committee? There being none, Mr. Weiss, will you please call the next panel or witness to testify?
Jennifer Bennett.
Hello.
Could you please
Hello?
state, good afternoon, Jennifer. Could you please state your name for the record and proceed?
Jennifer Bennett.
Please proceed.
So I guess I want to start by saying that I was homeless between 2003 and 2008, and I only just recently, within the past few years, even learned that there is an Office of Homeless Services. So I think that is an issue, and even now, people that are experiencing homelessness, they know about outreach, but people, a lot of people do not know that there is an Office of Homeless Services in Philadelphia or how to access that office. So I think that is an issue, and I also feel like a lot of the services provided by that office are very insufficient and very inaccessible to most people. I feel like this hearing itself is even very inaccessible to most people that are affected by the issue. Like people that are living outdoors, even if they have devices, the battery power may not be charged. They are unable to testify at this hearing regarding their experiences with that office. But from my personal experiences and things that I witnessed, a lot of things need to change. There needs to be more representation from people that are homeless or have experienced homelessness in the Office of Homeless Services. I think right now they have one staff member who was like formerly homeless, but not even like chronically homeless, like the population that they actually serve. And I feel like that, like they're not open to criticism or ideas from other people. And I understand that people put time in to come up with these services, but you have to be open to hear from the people who are being affected. And it seems like the Office of Homeless Services focuses more on like services that are like things that people could receive through their insurance and through other programs rather than like actual housing and the actual process of getting people off of the streets and keeping people in their homes. There's just like all these other services and they're not sufficient. Homeless outreach, like there's so much money going into all these things that aren't an actual solution to the issue. And I think that the Office of Homeless Services should be speaking out about the fact that the Philadelphia Housing Authority stopped expediting housing to people that are in the shelter system, which has essentially created a crisis where people are trapped in the shelters. And if they start working, they're being given really short deadlines on getting out of the shelter, but they're not able to save up money to get out of their shelter. And I'm watching people, a personal friend of mine that has been like in the shelter for almost like 3 years, going through this like process of having a job. She got a job and she thought that she could stay in the shelter for a while and save up. And she was given a deadline, which wasn't enough time for her to save up money. So she quit the job and now she's like just still sitting in the shelter. So there's these cycles that are happening, and it seems like the upper level staff of the Office of Homeless Services isn't really open to the criticism. They just say they don't believe these things when they're coming from the people who live in there. There needs to be a clear oversight process and complaint process for people who are experiencing issues in the shelter. It shouldn't just be because a shelter staff said that a thing happened that it's just true. Like there should be a process for filing a complaint. There should be a grievance process before an individual is kicked out. People are kicked out on moments of notice from the shelter in storms, in any kind of weather, and there needs to be a grievance process. If you're renting an apartment, even if it's subsidized by the government, right, you get a process before you're removed. So why is it okay to just tell a mother and her children or a single person that because this issue happened, it could just be a personality clash between the staff and the person that lives there? Like, why is it okay to just send people onto the street with zero notice? And then there's another issue in the shelter where the Department of Human Services child welfare system is kind of held over parents' heads to keep them, so to say, in check. And there's a lot of crazy policies, like you can't allow another resident of the shelter to watch your child while you go look for a job or go to work. And I think that that's inappropriate. The shelter is the community at the end of the day once everybody lives in there. And if people want to assist each other in that way by saying, okay, well, you just got a job or you're going to an interview, I want to watch your child, why would the shelter sit there and call the Department of Human Services on people? So I think that I'm not really even sure of all the services provided by this office, but the issue that I see is that there's a lack of transparency and there's a lack of accountability, and there needs to be a really clear-cut process with each program that this office oversees for a point person for people to contact if they're having an issue with that department or if they need something from that department, and the process before kicking people out of the shelter. That's really important to me. There has to be a process, and there has to be a process before barring people. The shelter system is able to just bar people for 30, 60, 90 days without any kind of process. So, I think that those are the things that are most important to me, and to really see where the office has a pretty large budget, like where is that money going, and could it be utilized in a different way to actually solve the problem? And I guess that's all I have.
Thank you so much, Jennifer, for your testimony. Are there any questions or comments from members of the committee? I wanted to say, Jennifer and Sterling brought up a lot of important points that I'll be following up on after this hearing. So thank you so much for the testimony. Mr. Weiss, will you please call the next panel or witness to testify?
That was the last witness, council member.
Okay. There being no further questions from members of the committee and no other witnesses to testify, I will ask if there is anyone else present in this hearing whose name we have failed to call and that wishes to offer testimony on the resolution being considered today. This concludes the business before the Committee on Housing, Neighborhood Development, and the Homeless today. Thank you all very much for your attendance and for participating. Have a good day, everybody.
Thank you for the opportunity.